So, thank you, Dr. Kini. So, Dr. Kini from Guru Kripa Medical Clinic, New BL Road. Thank you so much for taking your time and addressing our concerns, all the concerns that we see with parents these days. So, one of the things that we typically see is parents are very concerned about the weight of the child. Be it a 2-year-old or a 2-month-old. So what would you say to those parents?
Yeah, weight has consistently been the most common concern for parents and one of the most difficult problems for us to address and to convince them about. Most parents have opinions based on information given by well-meaning but sometimes ill-informed relatives and friends, sometimes from their own experiences with their first child. And of course nowadays you can just talk to your phone and ask your phone what is the expected weight for a child who is say 10 months, and if your child doesn't conform to the answer, then up goes the stress. So what I'd like to tell parents is that weight depends on certain factors which are beyond your control. Things like the atmosphere the child was exposed to in the womb, the weight of the child at birth, the genetic makeup of the child. A child is expected to double its birth weight by about 5 months and triple it by 1 year. So a child who's been say 2.5 kgs at birth, if he's about 8.5 kgs at 1.5 to 2 years, it's all right. There's no need to stress yourself out. Similarly, children of parents who have been small when they were young tend to be small, and that's the genetic makeup of the child. So weight, if you ask me, of all the anthropometric measurements that we take, weight is the least important. The most important is the head circumference, which measures the brain growth. The second is the height, which measures the overall well-being of the child over a period of time. The least important is the weight.
Okay, so thanks. I mean, that takes I'm sure it will take a lot of, weight off a lot of parents' heads. Another thing that we have noticed is even until the age of 1, children are, exposed to very few, varieties or textures of food and flavors and all of that. So, are there some foods that the child should definitely not have until the age of 1? And what are all the things that parent can avoid giving? I mean, I'm not asking what the parent should give because I think the discussion will be and the variety will be quite huge. What would help to know is what the parent should not give the child.
See, it's a sad fact that in this today's fast world, infant and child feeding has become a sort of chore which parents want to finish in a hurry and tick it off their to-do list. And in the process, the fun is taken out of feeding. Most of the time they tend to prepare ready-made cereals or something like ragi and feed it repeatedly. So the child tends to get bored, and that is the beginning of rebellion and feeding difficulties. So I personally feel that feeding should be a complete sensory experience for the child. In the sense the child should watch the mother prepare the food, should hear the noise of all the food being prepared, you should smell the food, and all these factors lead to what is called stimulation of the cephalic phase of gastric secretion, which prepares the stomach for the food. Then the child has to actually feel the food, food of different texture, try and manipulate it into the mouth, and then taste it. By feeding a child directly, you are depriving a child of all these sensory stimulation, and which I don't think is the right way to do it. A child should be encouraged to eat on his own, and I think that concept is now called baby-led weaning. And believe me, many children enjoy that. And commonly parents ask me, can my child do it? I'm sure they can. Think of all the children in the slums or the children who go to Anganwadis and all. They go only because a meal is given, and who feeds them? They just eat on their own because they know that this is what I need to eat to remain not hungry.
So since you were talking about baby-led weaning, there are some research that is happening that baby-led weaning with that. Do you think there is a probable nutritional gap that the child will face if the child is allowed to self-eat starting from 6th month?
6 months may be a little too early.
Okay.
I would say maybe about 8 to 9 months. But some children do well even by 7 months. So each child is different. So we can't generalize like that. But it's up to you to give the child the variety and encourage him to eat it. Providing the variety is up to you. So there are a lot of concepts about infant feeding. Now the new concept is what is called choose my plate. And if you're aware of that, a large part of every meal should be fruits and vegetables. A small part carbohydrates and cereals, and another part is proteins with a component of milk. So as long as you see that these requirements are met, I don't think there should be any problem with nutrition in a child.
Yeah, thank you so much. Because this is information, I mean, a lot of parents I think are not aware that, by a certain age group before 1 that a child is capable of eating also, because of the force feeding and I mean, like you were saying, a lot of pleasure is taken away from a child by feeding the child and all of that. Another aspect of feeding that comes into picture is the feeding bottles. And I remember reading from your blog, you said the cow milk is best for the calf and the bottle is best on the departmental shelf. So can you please elaborate a little bit on that?
Yes, I agree that the bottle is a convenient mechanism for mothers to feed their child, especially the mothers who have to get back to work and have to leave their child with somebody else. But still, the bottle has its own problems. The common problem that we face is what is called nipple confusion. Once you give the bottle, the child gets a nipple which is longer and softer than the mother's, and also the milk flows much more easily and faster than the breast. And so, no prizes for guessing what the baby is going to choose. Very soon the baby is going to say, "Mommy, dearest, I love you very much, but I love the bottle more." And this bottle feeding is the commonest cause for failure of lactation all over the world. Not only that, the bottle is a common cause for problems later on, like gastroenteritis, teeth problems, colic. So there are a lot of problems associated with bottle feeding, so it's best not started at all. Coming to your other question of cow's milk. Cow's milk is absolutely adequate in all nutritional aspects for its child, the calf. Whereas for our babies, it is deficient in a few factors and has an excess of few factors. It is deficient in iron, it is deficient in vitamins, a few vitamins, and also a few essential fatty acids, whereas it has an excess of sodium, it has an excess of protein. And also the protein in cow's milk is less easily digestible by humans than human milk. Formula, which by the way is made mostly from cow's milk, is a little better because the protein has been treated a little, but still it is nowhere comparable to the nutritional value of breast milk. So breast milk is the best.
So supposing you, so at what age do you suggest if cow milk needs to be introduced? I mean, first of all, does cow milk need to be introduced at all? Then at what age?
We do not recommend cow's milk to be a part of the diet till the age of 1.
Okay.
Up to the age of 1, it can be introduced, but not by bottle.
Not by bottle. Now I've come across a lot of parents and families who have, for whatever their reasons may be, using the bottle, and much beyond the age of 1. So I'm sure they are all, facing the implications and all of that, and you have also suggested that, it should be taken off from there. But what are the implications in terms of their jawline, the teeth, and the food implications, and of continuing the bottle beyond the age of 1?
Like I have mentioned earlier, bottle has a lot of problems. So if I have to get a child off the bottle, I would first concentrate on convincing the mother and the grandmother, because if I manage to convince them, half the battle is won. How to go about it, there are two schools of thought. Some say that stop it abruptly, let the child cry for a week, and then he's going to be off the bottle, he's going to give you some in good sleep in the night, etc. But I would prefer the middle way of trying to slowly get him off the bottle by giving him the bottle, but giving him a better alternative. What I would say is, give him something which is not so tasty and not his favorite in the bottle, like some kadwa juice or something, whereas you give him a nice juice in a glass, or give a diluted milk in a bottle and give him whole milk in a glass. And nowadays we have, I'm not aware, I've heard that there are some wonderful glasses which are non-spill glasses, so I'm sure the question of baby making a mess is not there. So I do not recommend the sippy cup, because the sippy cup is as difficult to clean as the bottle and also a source of infection, so no sippy cup. Bottle infections caused by the bottle are many, and like I enumerated, teeth problems, ear infections, because the baby lies down and drinks, and sometimes milk can go to the ear, can lead to gastroenteritis, can lead to colic. So all the more reason for stopping the bottle at the earliest. ASAP.
Yes, thank you so much. Based on all of your experiences, I'm sure you have a lot of patients coming in every day, and so what is your go-to advice for all of them?
See, problems with feeding are numerous and affect parents with children of all ages, even up to adolescence. So the list will be huge. So I think I will stick to the most commonly encountered questions or statements made. And the commonest statement which mothers make is, I don't have breast milk. And this assumption is based on the fact that baby is crying. So I would like to reassure them that breastfeeding is not rocket science. Babies have been breastfed for generations, and we human beings are the only mammals who have alternatives. I am yet to see a cow who doesn't have milk. So I think we should let nature take its course. Start breastfeeding as soon as the baby is born. Some hospitals have this practice of separating the mother and the child, which I strongly disagree with. Rooming in is what should be done. The baby should be next to the mother, so that the mother can pick up the baby and feed as often as required. The young mother should be given proper support by family, and this thing. Just a casual comment that you don't have milk is enough to set her thinking negatively and affecting the flow of milk. Good nutrition during pregnancy and immediately. I see mothers wearing sweaters and warm clothing in the peak of summer, and not getting milk, not getting water, not getting enough drink, which is not the right thing to do. So that plus a positive attitude, I'm sure, will help most mothers to adequately breastfeed. The two stimuli for milk production is baby sucking at the breast and emptying of the breast. So as long as these two criteria are met, the milk production automatically increases. A way to make out whether breast milk is sufficient or not is to count the urine output. The baby is passing urine more than 5 to 6 times in 24 hours, and if the baby is gaining weight, that means the milk is sufficient. Babies cry for a variety of reasons. Baby may need to be picked up, baby may have passed urine or stools or many other things, colic, etc. So every time the baby cries doesn't mean the baby has to be fed or that the mother has insufficient milk. The next common problem is weaning. So I have tremendous pressure from the grandmothers saying, baby is 4 months old, let me feed the child, baby mother's milk is not enough and all. And I have a lot of difficulty convincing them that breast milk is more than enough for 6 months of age. And even when you start after the age of 6, the weaning should be an experience which the child looks forward to. And for the child to look forward to food and eating, the child has to be hungry. So the child should be fed based on his wishes and not the wishes of everybody else. So, and another common factor I have seen these days is maybe the mothers sometimes feel guilty because they work and they don't spend enough time with the child. So they pamper the children to such an extent that the moment the child asks something it is immediately given. So the child says, if you want me to eat, I have to have TV. I have to have the mobile. So the mobile is there, the child is not even consciously looking at what it's eating. So no electronic media during eating. No distraction of any sort. The child should not be taken out of the house, should not be, shown the car, the bus there or plane, etc. Eating should always be on a high chair at the, when the child wishes to eat. If the child says no, cancel the meal. There's nothing that's going to be lost by missing one meal. Next meal the child will be hungry and will be eating much faster. Third problem, after the age of 1, common advice given to the mother, your breast milk is causing the child to not eat. So stop breastfeeding. Another absolutely wrong advice. Breastfeeding should be continued for as long as possible. And we nowadays recommend even 2.5 years. As long as the mother has no problem, as long as the child and mother are comfortable, breastfeeding can be continued. Breastfeeding is not going to interfere with the growth or the eating of the child in any way. If at all, the breastfeeding conveys a lot of benefits to the child, prevents infections, gives him immunity, helps prevent constipation. It's even thought to be important for brain growth. So breastfeeding should be continued for as long as possible. Remember, these children are growing in a very wired and information-filled world. So at the age of 6, if you scold your son saying you didn't do well in maths, he's going to go on the net and then ask, how long have you breastfed me? And if you say 6 months, he says, that's why I've not done well in maths. So be careful, parents. This is what you're going to face in the future.
Thank you so much for that last thought. I mean, yes, I have been seeing it already happening, with my previous generation. And yes, I'm very, very sure, children will look it up, and because we are in such a world where so much of information is available, this will come back to parents at some point in time or the other. But yes, on a very serious note, I think whatever you have said makes a lot of practical sense, and I really, really do hope that some parents out there are reassured and assured, and especially more than parents, I think the grandparents also, we need to assure them and reassure them is to follow the child and to observe and follow the child and do the right things for the child. Thank you so much, Dr. Kini. It was wonderful talking to you.
Thank you very much.